How do you recognise body dysmorphic disorder in a patient?
These are a group of patients who one needs to be very aware of and very careful of. That sounds a defensive thing to say, but it's not entirely, because also from their perspective, most of these patients, if they have an operation, their psychological condition will be worsened, not improved. So if we see somebody who fits into that category of over obsessing about a particular aspect of their anatomy, they've had 4 rhinoplasties before, they're still not happy, and you can't really see what it is that they're not happy about, for instance, then I think one needs to think very carefully about whether the right advice for that individual is actually psychological counselling with somebody experienced in dealing with these kind of problems, rather than an operation, which is likely to compound the problem, not improve it. And I don't know whether it's a condition which is becoming more common. I have the impression that it is. Or whether it's just that whether people's expectations are being encouraged by social media and the rest to be unrealistic, or people who may not have sought surgical advice will now, or maybe they will do much younger before they've had time really to consider it. The most important thing is, can you see what it is that they're complaining about? When I say complaining about, what's upsetting them? So if somebody says, well, I don't really like this aspect of my nose, for instance, I can't really see what it is, that's not a good start, because if they can't demonstrate it, I can't see it, then it's unlikely having an operation is going to improve things for them. As I said, if they've had a lot of surgery before, and it's a wise surgeon who, presented with a patient of that type, will seek permission from the patient to communicate with the surgeons who have done the surgery before, and preferably with their GP. And I think it's a foolish individual who will reoperate on somebody again in that circumstance without gaining any of that background knowledge. And if a patient doesn't want you to communicate with the other individual, you have to ask yourself why.